Webinar discussing the 2017 individual health insurance options through the Chicago Bar Association Health Exchange, powered by IX Solutions. My name is Johnny DeVito. I am the Senior Benefit Consultant here at IX Solutions. Just to provide you a quick background on myself and the company, I've been with IX Solutions since our inception back in 2010 and have been entrenched in the Post-Affordable Care Act health insurance space ever since. Over the last couple of years, my focus has been primarily in the individual exchange market, and I have very much been part of this ever-evolving industry. IX Solutions has a strong focus in the individual as well as small to mid-size employee benefit space. IX Solutions, 28 years of experience as a fully owned subsidiary of Flexible Benefit Service Corporation. As a whole, our organization works with individuals as well as employers with small group, individual, and Medicare health plans, in addition to ancillary products such as dental, vision, disability, and life as well. We are also a third-party administrator of tax advantage accounts and COBRA plans on a national basis. We also have a full-blown compliance department that supports our clients, making sure that they are compliant with the ever-changing laws of the Affordable Care Act. Our goal as a company is to educate and bring clarity to this highly regulated and ever-evolving industry. That being said, the topics that we're going to discuss today are benefits to the members of the Chicago Bar Association, local market updates, what we recommend for 2017, and then we'll wrap up with a brief demo of the CBA Health Exchange and how to shop for plans. That portion will actually be provided in an additional tutorial where we're going to break out the experience when shopping for individual health insurance plans on the CBA Health Exchange. All that being said, members will have the ability to shop, compare, and enroll into multiple plans electronically, all on one platform. Members will have guidance and support both pre- and post-enrollment, as well as access to a free subscription to Health Advocate. Health Advocate is a company that we have partnered with that provides access to 24-hour phone hotline, as well as a number of services such as finding doctors, specialists, and hospitals that will accept your health insurance plan, medical claims and billing issues, answering questions, as well as interpreting lab results or any test results that you have done, locating elder care facilities, and a number of additional services that may be of need in the health insurance space. Before we jump into the local market update, I would like to provide a little background and insight on what has occurred over the last 11 months with the carriers due to the Affordable Care Act. The insurance carriers have all faced losses over the last couple of years, and more specifically, Care Act. Many of them have reacted to these losses in a number of different ways. Some carriers have narrowed their networks, restricting access to certain doctors and hospitals. Others have eliminated their PPO network altogether, and others have left the market entirely, and therefore not going to be offering products in the 2017 marketplace. Local market updates. Harken Health, a subsidiary of United Healthcare, took on a lot of business last enrollment as it was one of the only carriers that offered a large PPO network. Harken Health will no longer be offering this PPO network and is only going to have HMO plans available in the 2017 market. Aetna, a carrier who also previously offered a large network called a POS or point of service product, which is essentially a hybrid of a PPO and an HMO, is only going to offer limited HMO options as we know it today. This has not been made official, but there is word that, or buzz, if you will, that they are going to follow the trend with the rest of the carriers in the HMO space. Coventry, which was recently acquired by Aetna, for a portion of the state of Illinois, but only have products downstate in southern Illinois. United Healthcare has chosen to leave the individual market entirely outside of a handful of states on the East Coast. Land of Lincoln, another carrier that offered a large PPO network, last open enrollment, unfortunately had to close its doors this year and will no longer be in business in 2017. Cigna is a new carrier that has entered the Chicago market and will be following the HMO trend as well, and will not have a PPO in 2017, but exclusively HMO products. And last but not least, the only carrier in the Chicagoland area that have a PPO product is going to be Blue Cross Blue Shield of Illinois. Blue Cross will be offering the same narrow network PPO as they did last year during open enrollment, with majority of doctors and hospitals in that PPO, excluding the major teaching hospitals in the city. However, Blue Cross will be able to give you access to a few of the teaching hospitals with their HMO products, and we're going to discuss that here in a minute. All that being said, our recommendation is to strongly consider Blue Cross Blue Shield of Illinois for your individual health insurance plan in 2017. Blue Cross is the largest, most reliable, and stable carrier in the Illinois market, hands down. Blue Cross is the only carrier that's going to have the large PPO, or the narrow network PPO that they offer, but it is going to be the only PPO option available in the individual market, as well as an HMO, as previously mentioned, that will give you access to North Shore facilities, as well as Advocate and Central DuPage hospital systems. Lastly, it's important to mention that over the last couple of years, we've seen carriers come and go, as well as make promises that unfortunately they were not able to deliver on, such as competitive rates and access to specific hospitals. Blue Cross, on the other hand, has not wavered that they were not able to keep. So that being said, they still are the best when it comes to customer service ratings, and they are the easiest when it comes to dealing with filing claims and getting claims paid. Your health insurance options are going to be Blue Cross Blue Shield of Illinois, as well as the ancillary carriers that you can see on the slide there, such as VSP, Delta Dental, MetLife, and Principal, some that are not shown there, but products that we do offer to individuals for things such as dental, vision, life, and disability. Just a couple of dates to be aware of for a January 1st effective date. You will have to enroll sometime between 10th of 2016. Once again, that's going to be for an effective date of January 1st of 2017. Should you miss that deadline of December 15th and enroll between the 16th of December and the 15th of January, you will be shooting for a February 1st effective date. Should you miss that January 15th deadline, you'll have the ability to enroll at the tail end of open enrollment between January 16th and January 31st, and that will secure you a March. The important note to take away from this slide and these dates is that if you are going to be going for a January 1st effective date, it is important to enroll between November 1st and December 15th. Short-term policies. I'd also like that we do get a lot of calls and questions about these products. Therefore, short-term policies are meant to cover you for a short period of time. At this point, there's really no heavy restriction on the duration of these plans, but there is currently a law that is trying to be passed that will limit these durations to a maximum of 90 days. Carriers that offer these products are Blue Cross Blue Shield of Illinois, as well as United Healthcare. And fortunately, these products do give you access to their large PPO network. On the other side, though, these products are going to be underwritten. Unlike fully insured products, they therefore can be declined. An individual can be declined as well as rated up for pre-existing conditions with these short-term products. Next, I'd like to discuss the Blue Cross HMO products, as these products are going to give you access to specific doctors and hospital systems that you will not have access to through the narrow network PPO. The Blue Precision HMO is the traditional HMO that Blue Cross offers and will provide access to North Shore doctors and hospitals as well as Central DuPage. The Blue Care Direct HMO is a new product as of last year's open enrollment and had great success. Blue Care Direct is a product that was created in collaboration with Blue Cross and Advocate and is an open access HMO. Open access meaning you do not need a referral, and you can utilize all the physicians and hospitals that are associated within or with the Advocate hospital system. It's also important to note that the premiums for these Blue Care Direct plans are significantly lower when comparing them to the most comparable Blue Precision HMO, the traditional Blue Cross HMO. And then lastly, Blue Focus Care is a new product this year, starting January 1st, 2017. It's a very similar product to the Blue Care Direct. However, this product is specific to local hospitals in Cook County. In conclusion, the individual health insurance market has transitioned back to the HMO model. Therefore, it's important to select a plan that is specific to your doctors and hospitals of choice. It's also important to know that IX Solutions is a member of the Chicago Bar Association. That'll be the end of today's presentation, but feel free, if you have any questions, please contact us on the slide showing on the screen right now. There is an 888 number that's specific to the Chicago Bar Association and its members. You can also visit the CBA Benefits Center page, as well as poke around on the CBA Health Exchange and view quotes, as well as search for doctors and hospitals that will fit your family needs best. So thank you again, everyone, for attending. Please contact us with any questions, and we look